Telehealth at the Crossroads, a consultant's case for collaboration. Good afternoon, and thank you for being here. My name is Beckett Flanagan, and today I'm presenting in the role of a telehealth consultant to a multidisciplinary audience that includes healthcare providers, patients, policymakers, technology experts, and business leaders. My goal today is to make the case that telehealth only works when all four of its core perspectives, provider, patient, policy, and technology and business, are working together in alignment. As we have seen throughout this course, telehealth is not simply a pandemic-era workaround. It has become an essential and permanent component of our evolving healthcare system. Let's get into it. To understand telehealth, you first have to understand that it is not a single system. It is four interconnected systems operating simultaneously, and each one depends on others to function. First, the provider perspective. Telehealth allows healthcare professionals to serve patients who would otherwise lack access to care, reduce missed appointments, and build trust across distances. But providers cannot operate effectively without favorable policies around licensing, privacy, and insurance reimbursement. Without that policy support, providers face serious barriers to delivering telehealth at scale. Second, the patient perspective. For patients, telehealth means convenience, accessibility, and reduced costs. Most patients whose telehealth report high satisfaction because it saves them time and eliminates transportation barriers. However, not all patients benefit equally. Digital literacy gaps and lack of reliable internet access remain serious obstacles, particularly in rural and low-income communities. Digital inclusion must be understood as a social determinant of health. Third, the policy perspective. Policymakers create the legal and financial framework within which telehealth operates. Decisions around Medicare, reimbursement, cross-state licensing, and data privacy laws directly shape what providers can offer and what patients can actually access. Policy is arguably the most powerful lever in the entire system. And fourth, the technology and business perspective. Companies like Teladoc have driven enormous innovation in telehealth delivery, but they also introduce real challenges around cybersecurity, digital ethics, and long-term business sustainability. The business model must strike a careful balance between accessibility and profitability, and that tension is ongoing. A real-world example. Let me bring this interdependence to life with a concrete example that illustrates these four perspectives better than any abstract diagram could. Imagine a patient living in rural Arizona who has been diagnosed with diabetes. She does not have a specialist within a reasonable driving distance, though telehealth offers a solution, but only if all four perspectives are aligned at the same time. She needs a wearable glucose monitor that transmits her data to her provider in real time. That is the technology perspective. She needs a physician who is licensed in her state and willing to conduct virtual consultations. That is the provider perspective. She needs her insurance plan to cover those virtual visits at a reimbursable rate. That is the policy perspective. And the Centers for Medicare and Medicaid Services have been central to expanding that coverage. And she needs a reliable broadband connection in her home to make any of this work at all. Remove any one of those four elements, and the entire system collapses for this patient. This is what I mean when I say these perspectives are not independent. They are deeply and structurally interdependent. So, what does it take to keep all four of these perspectives aligned? The answer is cross-sector collaboration, and it is harder than it sounds, but more essential than ever. Policymakers need to work directly with providers and technology companies to craft regulations that protect patient privacy without strangling innovation. Businesses need to design platforms with real user needs in mind, not just market opportunity. Providers need to advocate for technology that genuinely improves care rather than simply adding administrative burden. And patients need to have a seat at the table because their lived experiences reveal gaps that no boardroom conversation will surface on its own. A practical example of where this collaboration is urgently needed right now is in college campus health. Bringing effective telehealth to university students requires coordination between universities, healthcare organizations, insurance companies, and software developers, all simultaneously, all working towards the same goal. When the coordination happens, the results are powerful. When it does not, students fall through the cracks. One of the most important concepts I want this audience to take away today is that these four perspectives do not just coexist. They react to each other in real time. A change in one triggers a chain reaction across all others, and the COVID-19 pandemic gave us the clearest possible demonstration of this. When the pandemic hit, policymakers moved quickly to relax telehealth regulations and expand Medicare reimbursement for virtual visits. That single policy shift immediately changed provider behavior. Physicians who had never used telehealth before began adopting it rapidly. That surge in provider adoption dramatically expanded patient access almost overnight, and it accelerated investment by technology companies and telehealth platforms because the market had suddenly and massively expanded. Now consider the reverse scenario, which is actually playing out right now. If policymakers roll back those reimbursement expansions, providers will scale back their telehealth offerings. Patients who come to rely on virtual care will lose access, and technology companies will face shrinking demand, which slows innovation precisely when we need it most. This is why my consistent message to every stakeholder in this space is this. Your decisions do not stay in your lane. They travel across the entire system, and you're responsible for understanding that ripple effect before you act. Looking ahead, the future of telehealth is genuinely exciting, but it is not without serious obstacles that this audience needs to understand clearly. On the opportunity side, artificial intelligence is beginning to transform diagnostics, allowing virtual platforms to identify potential health concerns with increasing speed and accuracy. Remote patient monitoring is becoming more sophisticated as well, enabling continuous care for chronic conditions without requiring patients to leave their homes. And telehealth carries real potential to meaningfully reduce long-standing healthcare disparities by reaching populations that the traditional system has consistently underserved. If we design it with equity in mind from the start, but the obstacles are equally real. The digital divide remains a fundamental equity problem that no amount of technological innovation can alone solve. Cybersecurity threats to patient data are growing, not shrinking, as well as payment models remain inconsistent and politically contested. And as finally, policy frameworks vary so dramatically from state to state that providers and businesses struggle to scale their services effectively. The path forward requires all four perspectives working together. AI is only as useful as the policy framework that governs its use in clinical settings. Remote monitoring only helps patients who have the devices and connectivity to use it, and innovation only reaches underserved communities if business models are designed with equity as a core value. Let me close with this. Telehealth is not a technology story. It is not a policy story. It is not a provider story or a patient story. It is all four of those stories at once. And the only way to deliver on its promise is to make sure every perspective has a voice in the room and a role in the solution. Providers deliver the quality, patients define what accessibility truly means in practice, policymakers create the conditions for fairness and sustainability, and the technology and business sector drives innovation that makes all of it possible at scale. When those four elements are in balance, telehealth works and patients benefit. When any one of them is missing or misaligned, the whole system suffers and real people pay the price. My recommendation to every stakeholder in this room is straightforward. Do not work in isolation. Seek out the perspectives that differ from your own. Build the cross-sector relationships that make true alignment possible. Because the future of healthcare delivery depends not on any single breakthrough, but on our collective willingness to make those breakthroughs work for everyone. Thank you, and have a good rest of your day.